There are a number of chronic bowel problems that may or may not be related to colon cancer. IBS, which is irritable bowel syndrome, which is quite common in our society, is not related to an increased incidence of colon cancer. However, there is Crohn's disease, which is an inflammation of the small bowel and colon, as well as uh, colitis, or ulcerative colitis, which both of these uh, do increase significantly the incidence of developing colon cancer. Certainly, in both ulcerative colitis as well as Crohn's disease, one should have a colonoscopy more often and start it at an earlier age. With IBS, the recommendations are to do colonoscopies depending upon your symptoms. And if one has a IBS or irritable bowel syndrome that is not causing much problems, doing colonoscopies routinely every 10 years at the age of 50 makes a lot of sense and is what the recommendations are. However, many times IBS, irritable bowel syndromes, when it's poorly controlled, can give you symptoms similar to colon cancer, and one should not miss the chance of doing screening in those situations. Again, IBS, not related to an increased incidence. Ulcerative colitis, Crohn's disease, is related to an increased incidence of colon cancer.
For an interactive tool to learn more about your colon cancer and your personalized treatment options, go to mycoloncancercoach.org.